Good morning, everybody. I'm Kim Williams with the Indiana Parkinson Foundation, and we are so happy to be here with you all today for our April edition of IPF Talks. And today we have Kelsi Worthington with us from Home Helpers Home Care of Carmel, and I'm super excited to bring her on to talk with us today about, getting a better understanding of home care and what that looks like and how it can help you when you're living at home and improving your quality of life and just helping you to enjoy the things you've always enjoyed. So, Kelsi, welcome.
Thank you. Hi, everyone. Thank you so much, Kim, for allowing me to come on here today. And we had a great time at the Choose to Move race on Saturday. And although it was super cold, we still had a great time. It's always really great to hear all the stories and network with a lot of people there. So we're looking forward to next year as well. So today we're going to talk about understanding home care and improving quality of life and enhancing outcomes. Let's see here. Here we go. So I first want to start off by just going over my why. When I was younger, my mom's parents, and they were my grandparents, had their own healthcare challenges to go through. And as you can see here in the middle pictures, this is my grandma right here and my mom. She had bone cancer. And if any of you have ever dealt with anyone that had been diagnosed with bone cancer, it's very excruciating, painful, and one of the most painful cancers. It's really hard to watch someone go through it. At the time, my mom wanted to bring her home and be her full-time caregiver, but because of her acuity needs, she was placed in an in-facility hospice. That was the only resource that was ever given to my mom and her siblings for support. So every day after school, I always remember the car rides going to visit her. They were gut-wrenching just because my mom couldn't be there for her mom 24/7. It was always focused on the facility, not creating more memories with her. She had to pick up my grandpa a lot of times too and take him with us. So it was just an emotional time for her. She ended up being in the facility for, I believe it was 8 to 9 months before she passed away. But as you can imagine, visiting her every day, very time consuming and has an emotional aspect with our family. And then my mom decided to move him in with us when she did pass away. And it's something she wanted to do for my grandma. So she was very happy to move him in. And it was really interesting to see two different sides of this. With my grandma being in a facility and the emotional distress it caused my mom for not being there 24/7, and then being there 24/7 for my grandpa, definitely caused a lot of emotional and physical stress on my mom. She worked full time still. She was managing her kids, her household. She was making sure his needs were met, taking him to appointments, doing everything to benefit his health and being his full-time caregiver. And she definitely put him over herself and her needs first. So it definitely was hard to watch the emotional distress that it caused. There was frequent hospitalizations that he did have, and it just overall just is hard to watch my mom go through. So because of growing up and watching my mom go through this, it made me realize that I want to go into some type of healthcare setting where I can be an advocate on resources. So my name is Kelsi Worthington, and I am the Business Development Manager for Home Helpers Home Care of Carmel. I'm a Fishers, Indiana native. I've grown up in Indiana my whole life, and I am an IU Bloomington graduate. I did graduate with my degree in public health. It was very broad for me to do public health because I didn't know exactly what I wanted to do yet. I just knew I wanted to do something in healthcare. So right after college, I went into durable medical equipment. I started in the respiratory program, and I specifically focused on adherence to CPAP and BiPAP machines for our patients. And it was really helpful to make sure that they were compliant on their machines. And then I went over to more higher acuity patients. I worked on ventilator support and oxygen machines as well. So I educated doctors and hospitals on these and helping them get approved through insurance. And then I moved into home care, and I've been in home care for almost 2 years now, and this is definitely the place for me. I love having the ability to both educate healthcare professionals and also be able to be involved with the families too, and be an advocate for them. Our owners are Phil and Michelle Nunn. They founded the company in 2018. Michelle is a registered nurse. She has been in the healthcare industry since she was 16. She was a CNA at 16 years old, so she does have a multitude of experience in the healthcare field, and she loves every second of it. Phil, which is her husband, they are a husband and wife team. He was an executive banker for 20 plus years, and that really helped his background in leadership and management. And combining the two experiences has really built a great business foundation. We have grown every year and we're continuing to grow even more. And the thing that I really love about Phil and Michelle that makes them stand out is they genuinely care for others. So that's one of the reasons I joined the team. And again, we're just growing every day and just focusing on compassionate care. This is our leadership team. So we have Steve, who's our executive director. He came over from Durable Medical Equipment with me, so it's kind of great to have that experience as well related to him. And then Deandra is our client coordinator. We call her our chaos coordinator because we don't know how she does it, but she's awesome. And Cheryl is our quality assurance manager. She focuses on our caregivers and clients. And then Brenda is our recruiting manager. So taking a look back at my why and really breaking it down, I always picture all of the problems that were in that why story and how we could have created better outcomes for my mom's family and her as well. And today I want to just talk about 3 common problems that we see in the healthcare and specifically the home care industry. And problem number 1 is hospital readmission rates. It's a critical issue nationwide, and it really does impact hospital ratings, reimbursements for Medicare, patient outcomes, and it really is something that we need to focus on. The last thing you want to do as a healthcare provider is discharge your patient home and they're back in the hospital 2 days later. So it's something nationally that a lot of hospitals and rehabs facilities will take a look at just to see how they can decrease that rate. It's really important for us to look at this just because gives us the need for effective transitional care from rehab or hospitals to home and ongoing patient support. Currently, nationally, the readmission rate is 14.6% when a patient is discharged from home with no care at all. So what we do at Home Helpers is really strive to see how we can decrease that rate. And later in this presentation, I will talk about how we achieve this. Problem number 2 is family burnout, or as I should say, family caregiver burnout. In my why video, I'm sure you realized the emotional and physical exhaustion that my mom and her siblings went through taking care of your loved one. I'm sure some of you on here have gone through that as well, and it's a growing concern nationally. So what we like to do is just really take a look at how we can reduce family caregiver burnout and really create a need for reliable professional support solutions for the families. A lot of times we get the call every day, families say they're just so overwhelmed and don't even know where to begin. So we really want to be a resource for them and make sure that we're doing everything we can for them. I always like to coordinate this to flying on an airplane. I'm sure most of you have been on an airplane and commonly know the flight attendant speeches on safety measurements. Some of us may not pay attention anymore because we know them so well. But something that always stands out to me is when they tell you to put your oxygen mask on first before you assist others with putting theirs on. And really having that correlation and it really relates to family caregiver burnout and what can we do to put into place to really make sure that your loved ones are getting the care they need, but you're also getting the care that you need. And then problem number 3 is lack of resources and education. My family, when my grandma and grandpa were going through their health concerns, really the only resources that were provided to us is an in-facility hospice. They didn't really make it something that they basically said that that was my parents' only option at that point. There was no other resources for home care, long-term care facility. There was just nothing provided to them. And then with my grandpa, really the only thing that was given to us was durable medical equipment, wheelchair, hospital bed. So that was the only resources we had. And this really is a huge problem with families feeling unprepared for needs at home. There's several misconceptions that I'll go over today regarding home care and kind of debunk those. And we just really want to make sure that we're providing these resources prior to when you actually need them so that we're educating both families and healthcare professionals. Having a lack of home care resources and education can really increase risks of complications, stress, hospital readmissions, and the list goes on. So we'll talk about in this presentation how we go about providing these resources to families. So let's start off by talking about what is home care. Specifically for Home Helpers Home Care, our mission we live by every day is goal-oriented care creates better health outcomes. We say that on a daily, we say in our team meetings, we really do believe that focusing on goals really enhances better outcomes for families and patients. So we want to make sure we focus on this to promote independence, safety, and quality of life at home. I will go into more detail later about our assessment process, but we're really focused on personalized care plans to really make sure that we're preventing those rehospitalizations and complications when patients do discharge to home. And home care is key for really lowering readmission rates and improving patient satisfaction. The key benefits, people want to age in their own home. AARP did a study last year where 75% of adults aged 50 and older wish to age in their own home. And that was astonishing to me. I feel like in today's society, a lot of people are moving more into they want to stay at home with their family, they want to be with their spouses, they just want to stay on the property they lived in for so long. So it was really great to see these numbers and what we can do to provide these resources and prepare them to stay at home. And it also supports goal-oriented care that drive better health outcomes, and it also helps the family be a family member again. That's one of our main goals is we want to make sure that the family are still creating really great memories with their mom, father, uncle, aunt, friend, family, and we want to be there to support that. A question that I get often on a daily is the differences between skilled and non-skilled care. I'm sure my team would say the same. They get phone calls daily thinking we're skilled home health too. So we always like to give the education on the difference of the two because there is a huge difference between both of them. Starting with the non-skilled home care, the services that we provide is assistance with your activities of daily living, bathing, dressing, meal prepping, essentially anything that will help you support your independence. These providers are usually caregivers, home health aides, or CNAs. Again, our goal is to support independence and prevent further complications and hospital readmission. The setting is home-based. It's non-medical support. And I'll go into further detail on insurance coverage, but we're typically private pay, long-term care insurance, VA benefits, and Medicaid waiver as well. A lot of times we do partner with skilled home health. We believe that having that additional support of therapy is great, and it also creates better outcomes. So skilled home health is medical care. That can be your nursing, therapy, wound care. It's often provided by licensed nurses, physical, occupational therapist, and speech therapists as well. And their goal is to treat the medical condition and help individuals who are recovering from illness or surgery. It is also home-based, it's medical intervention, and it is covered by Medicare, Medicaid, and private insurances. The key difference between the both is that skilled home health, their shifts typically last from 45 minutes, maybe to an hour and a half a couple times a week. It's nothing that you get 8 hours a day. That would be your non-skilled home care. And then also there is a limit on how much skilled home care you can receive. Typically, we see patients receive this care anywhere from 2 weeks to a couple months until Medicare or their insurance does not provide any more care, or they're getting better with therapy. And with home care, obviously that can last a lifetime as well. So let's discuss some payer sources for non-skilled care. This is one of the biggest misconceptions in the industry is that it's all private pay. Yes, but there are other options as well. The first being long-term care insurance. These policies are reimburse the patients directly for costs for non-skilled care. I won't go into too much detail, but typically there is like an elimination period. And once that period is over, then the long-term care provider will reimburse the client for those services that are provided. A lot of families don't realize that they've been paying into these policies for a long time. We've had a lot of clients we've done assessments with that say, oh, I didn't even know I had this. So we just help them with that process and make them better understand the details of their policy and what it entails. Next is VA benefits. I could do a 2-hour seminar on this. I'm very passionate about our veterans. There's 2 different ways that we can get veteran benefits that oftentimes they are unfamiliar with. The first is aid and attendance, and that usually goes by your income. It's income based. And it also supports surviving spouses of veterans. So if we have a family whose spouse had passed away that was a veteran, they never realize that they can get support as well. So we help them apply for that process. And then also homemaker and respite services that goes directly through the VA. And it's usually for veterans who are at least 70% service connected. So we are a huge advocate for VA benefits and getting those increased. My dad works at the VA and he's always hearing from me all the time. But we do partner a lot and we make sure that these case managers are aware of what these home needs look like. A lot of times Michelle or I will send in our assessments to show the ADLs and IDLs that patients need help with to better get them advocated for more hours. And then also the Medicaid waiver program. I'm sure a lot of you healthcare providers have had a headache dealing with a lot of the changes the past year the Medicaid waiver program has had. We're hoping it's going towards the right direction, but it is state funded and it can cover non-skilled services for qualified individuals. I just actually did a assessment last week where I actually was able to see an assessment process that the Pathways program is providing, and it really helped me better understand what they're asking in these assessments to better educate families for this. So that's something that we're constantly learning more about day-to-day basis and that we help families set up. And then private pay, which is direct payment by individuals and families. So how does home help or home care solve these problems that we've stated today? We always like to provide solutions, and the first one for minimizing rehospitalization rates is all about our care plans. We want to have proactive care tailored to the individual and their goals to make sure that they're getting the care they need and providing those best outcomes. Again, I'll go into further detail of our assessment process, but we do believe providing those assessments and resources prior to something bad happening is key for minimizing those rates. Not only do we provide these resources during the assessment, but once we do have the client, we always closely monitor their health needs, their daily activities, and know these early signs of health decline if they are happening. All of our caregivers are trained to notice these signs. They do communicate with our office if anything is happening. We communicate that with the families and really create a tailored plan to help them. We even work with other companies that have fall prevention devices that will even it'll track how often someone's going to the bathroom and say, hey, this person may be at risk for a UTI. So we really take a close look and make sure we use those resources provided to us to help better serve the clients in their health. We also have a strong communication with their healthcare providers. We work with their doctors and we work with their families as well to make sure we're ensuring that continuity of care. We partner with several healthcare providers throughout, ranging from hospice to real estate. And we just really want to be a resource and making sure they're getting those resources when they need. Nationally, we have tracked our client rehospitalization rate, and it was at 3.2% for clients in the home care setting. And that was either with skilled home health or without. But as you can see from the 14.6%, it definitely is a decrease there. Obviously, there's still going to be some things that you can't solve. There's still going to be things that you can't help with, and we understand that. But as long as we're focusing on how we can reduce those, this number is definitely in the right direction. How do we reduce family caregiver burnout? And that really starts with the caregiver. The caregiver is the sole person that's really going to reduce that burnout from the family. It's going to give the families time to really spend time with their mother, their father, their son, their daughters, making sure that they're building those long-lasting memories. We want to make sure that we're giving them a reliable, consistent caregiver, and it just helps them relieve from daily exhausting tasks that they're currently doing for their mother or father. Also, flexible scheduling and respite care allows these families to recharge and avoid burnout. Um, Michelle was here. She would tell you the same thing. When we do assessments, oftentimes we, for example, have a daughter that says, I just need help with giving mom a shower today, or a couple times a week. And focusing on those goals, we go back and say, okay, let's focus on some goals that you and your mother have. Safety, social interaction, spending time with them, creating more memories with their families, all are great goals. And we end up finding out that daughter is actually cooking for mom, meal prepping all of her meals, taking her all to her appointments, basically essentially being the household care manager for her, instead of really creating those built memories that she needs to do with her mother. And we always design this as, would you rather sit with your mom and do things that you like to do together, card playing, going to get your nails done, going to see a movie, or would you rather spend your 9 to 5 and the time that you have with her doing things for her health, when we can provide support so you can spend the time that you need with her? And usually families don't see it that way, so we're always using that during our assessments to better help families understand that we're there to create and maintain these family relationships, and we don't want to replace them. We want to just provide additional support to help even increase those relationships. Something that we have started this year that I'm very excited about is couples care. This directly involves family burnout as well. Oftentimes there is a spouse that's taking care of their loved one, and we don't want to separate them. I see it time and time again in the industry where wife gets dementia and it gets pretty severe. Spouse gets overwhelmed taking care of them, and they end up sending the spouse to a memory care unit. And then the healthier spouse does not get to live with them just because they do not qualify, and it ends up separating them together. And a lot of these couples have been together 60, 70 years, and it definitely causes emotional distress on both of them, and essentially separation anxiety for the dementia client as well. We just took care of a client a couple weeks ago that this happened to, and they ended up pulling her from the memory care unit, and she's doing so much better being with her husband in the home with caregiver support. So it really does promote emotional stability and reduces the burden on the healthier spouse so that they can still be together in their own home. We do offer a discounted rate for couples care, and we've started it this year and have seen tremendous results. We provide that caregiver that allows us to customize both plans for both individuals to create unique needs. So overall, this has enhanced quality of life, independence, and overall family well-being for the couple. And then how do we help families with education and resources? That's essentially my whole role. We want to build awareness before it's too late. We want to make sure that we provide those resources and educate on the role and value of non-skilled home care so that they know these options for when they do discharge home. If my mom had options for home care, her outcomes would be so much different today than they would be when it did happen. I always tell my mom, did you even know home care existed? And she didn't. No, she didn't even know home hospice existed. So really providing these resources to families and both healthcare professionals is what I do in my day to day. And I do this by regular in-service workshops and presentations like I am today. And we partner with various community agencies in the healthcare industry, like the Indiana and Parkinson's Foundation, Alzheimer's Association, to really make sure we're providing these resources to families and debunking several misconceptions. We want to focus on providing empowerment to families to help them make informed decisions before a crisis does occur. A lot of times, what we see is a perfect scenario would be taking care of someone who maybe currently lives in like an independent living situation, like a 55 plus community. Even though they are independent, we do, 20 hours a week just to help them get used to home care. And then once their needs do increase, they are familiarized with home care, and we can increase those hours as needed and help them, have a better quality of life too. We want to provide these resources to case managers, social workers to better help the transitions from hospital to home. I've helped with DME setup before. A lot of times, discharges from rehabs especially can be very last minute, or hospitals. So we want to make sure we're providing all the resources that we can in time to get these services started in the home for your loved one. And we also collaborate with community organizations to ensure this continuous comprehensive care. So I want to take a little time to go over our assessment process, because this is the biggest key to really having a solution and helping all of the problems that we talked about today. And Michelle and I really focus again on goal-oriented care. Usually what happens is a family will call us, they'll call me or my team, and they may know nothing about home care, they may know a lot about home care. But we like to talk about, what are your top goals for your mom, your dad, your sibling, your spouse, that you want for them, and what are their top goals as well. And we really focus on all of those goals. And then once we do the assessment, Michelle and I bring those goals back up and tailor their care plan to those goals. This helps us determine the best approach to home care, gives us it's able for us to give recommendations based on this assessment and be very thorough with that. We also give resources during these assessments, whether it's, hey, we see this area has a lot of rugs or some bumps where your rollator can cause you to fall, which is a fall risk. We do that. We do home safety assessments. Or as, again, little as providing a real estate agent for you. We want to make sure you're leaving that assessment with not only knowing all about home care, but also having the resources that your family does need. So why does our approach of focusing on goal-oriented care to create better outcomes work? Really what we like to focus on is addressing critical issues, as such as hospital readmissions, family burnout, and lack of resources that we talked about today. The list can go on, but providing that goal-oriented care to create better outcomes can really be a solution to all these critical issues that we talked about today. Providing expert goal-oriented home care with a proven 3.2% rehospitalization rate, focusing on goals to enhance better outcomes, really empowering families and healthcare providers through proactive education and resources, and making sure we offer personalized, flexible care plans that focus on independence and quality of life is extremely important. So again, like I said, if you take anything today out of this, it's really making sure that you focus on goal-oriented care. That's going to help you have better and healthier outcomes for you or your family. Thank you guys for having me today. This is a QR code of my business card. It has our website information, my phone number. Feel free to email me if you would like. And then we also have social media platforms. We have a YouTube channel where we promote even further resources to families. So feel free to check that out. And I am open to any questions.
Thank you, Kelsi. That was wonderful and so much information. Um, I just wanted to ask, you talk about, not waiting till it's a emergency situation and not waiting when you needed this yesterday, right?
Mhm.
So when should a family or a caregiver start looking for your services if they're not sure when they are actually going to start the actual service?
Yeah.
What is that timeline? What works best for you as the, organization or business providing the service?
Right. And obviously that's a great question. There's some situations that you can't help, a huge life-changing healthcare event or health issue does happen to your loved one. Those are some things that you can't prevent. But really what we tell families is making sure that they're aware of the activities of daily living, knowing what those are and how to determine if your loved one is needing additional support with those. Once you feel that, hey, mom is having trouble bathing herself, or hygiene is especially important, and having those conversations is an indicator that, hey, we need to reach out for an assessment to see what we can do to support mom. Again, we help patients in independent living all the time. They may not need a ton of support, but it just gets them used to the fact of having that home support and help when they need, and we can always increase as time goes. But really, my biggest thing right now I'm focusing on with hospitals and rehabs is just making sure that we educate families right when they're admitted, giving those resources to them, and how can we prevent them from getting readmitted. So that's one of my main goals.
Wonderful. Thank you. Um,
Mhm.
Kelsi, we had a question come into the chat. They wanted to know uh, if you are a Medicaid waiver provider.
Yes, so we
Wonderful.
are a Medicaid waiver provider. And great question. I'm so glad someone asked about the takeaway from the Pathways interview. So I'm always trying to learn what the process is for waiver and getting approved. And I've seen a couple different ways. But the current patient that I'm working on is in a nursing home, and they're looking to discharge her home. And the case manager reached out to me to come to the Pathways assessment just so I can be an advocate and see kind of what their assessment process was like. And their assessment was very related to our assessment, talking about ADLs. They talked about income too as well. And mostly it was just pictured on what the care looks like at home. Um, and I believe the way that they do their assessments is seeing, is there someone in the family that can take care of this person so that the state doesn't have to provide the care. And I noticed that the son that was involved, they asked him a lot of questions on what his work schedule was like, what he was doing on a day-to-day basis, what his care needs looked like. And I think it was just because if they see a feel fit that he can provide that full support, then they wouldn't, approve additional hours for that. But it was just a really interesting process. And the good news is I think we're going to get her approved for a multitude of hours to really give her that support in the home.
Wonderful. Thank you for addressing that question, Kelsi. What about, I hear a lot in my caregiver support groups from my caregivers. People struggle with the fact that their loved one doesn't want a stranger coming in the home. And I know that that is something that I hear over and over again. And something that I know just through conversations with you and Michelle, and you guys work well with matching people with similar personalities or
Yeah.
people that are really going to get along together. How does that all look when someone is given a little bit of pushback to having the service come in?
Yeah, and that all comes down to the process of the assessment, focusing on personality and making sure that we find a good caregiver fit, like you said, is really important. I will say our scheduler, Deandra, again, I don't know how she does it. She's really great at that client caregiver match. And I mean, I like to ask the individual in the assessment, what do they like to do? What are their hobbies? There's a lot of times where I'll say, do you like to talk? And some will say, I don't want to talk our caregiver. Well, okay, let me make sure I have that in mind. So I'm not giving you a chatty Cathy every day. So making sure that we really provide what they're looking for in a caregiver really helps ease that transition. And then also when we do start care, what we do is called intros. And that's something that Cheryl really focuses on is she goes with the caregiver on their first initial visits to help ease that awkwardness of having someone in your home and really build that relationship and connection. And we found doing both of these has really helped build relationships for families.
Wonderful. What is the what are your backup plans? Like if a one of your caregivers gets sick or can't come to their shift and that loved one is expecting them in their home, what do you guys do to work around those issues?
Yeah, and that's a really great question. And it's a common problem in home care I hear often. And we've really provided a great approach to it is we have on-call caregivers throughout the week and the weekends. And once we do hear of something happening where, a caregiver may not be able to make their shift, we send that on-call caregiver. And all of them are trained in really any type of care plan, and they're able to just really jump in and start a care plan, even if they don't know the family directly. They're able to make those adjustments, and we haven't missed any shifts in I'd say the past 2 years. So it's really something to be proud about, and we want to make sure that we're providing care for loved ones even when their current caregiver can't. So those on-call caregivers really really help.
That's great. I have another question in the chat that's asking, what is some encouragement that you could share with people that feel like they're failing to, um, you know, if they feel guilty, for bringing in home health care because they're like, well, what? I'm the spouse or I'm the son or I should be doing this. What do you say to encourage them?
Yeah, and this all goes back to wanting to create memories with your family member rather than being their sole caregiver. I completely understand that, and that is definitely how my mom felt with my grandpa. She was doing any and everything that she can, and putting her dad first rather than putting her health first. And often families do that, a lot of times, but it just ends up creating burnout. So I always like to tell families, you know, we want you to keep building relationships and being with your loved ones rather than being their sole caregiver. So really showing them the importance of everything that they can do to achieve those memories before their spouse's time is unfortunately up is just really important. So I always like to tell them, we want you to keep your loved ones, and we want you to be able to still build those relationships and be with them. And that's that's something that you can't, you ask for. I mean, that's something that you want in life
Mhm.
is more time with your loved ones. So
Right.
great question.
Yeah. And if you guys are helping with the, things that might be exhausting, it just
Mhm.
allows them that time to do the things that are more enjoyable. So I love that.
Yes, for
I love
sure.
that. Um, so tell me a little bit about how you advocate for veterans that are in need of
Mhm.
these services. What do you do specifically in that area?
Great question. And again, like I said, I could talk 2+ hours on VA benefits. But we make it a point in the assessment or when a family calls to ask if they are a veteran. Some may say yes, but we have never been to the VA before. They think that they have to go to the VA to see a primary care doctor, and that's not essentially always true. We want to just make sure that we're able to provide those resources to them. And really, what I do is work with the case managers directly and advocate for their needs. There's a lot of times where we'll get a referral from the VA directly, and we go out and do the assessment, and we say, this is not going to slide with what they've provided for in-home care services. And we resend our assessment back. And it just having that advocate those needs. We've had families where, we get 12 hours first approval, and then they get up to 36 to 40 hours approved because of our assessments. So that's something that I really love to focus on and just help guide the families who have veterans.
Great, thank you.
Mhm.
And then one other question I have, if someone contacts you and they go ahead and have you come out and you do an assessment and they're like, okay, we're we're good. We really like what you have to offer, but we're not ready yet. What happens in those situations?
Yeah, and we normally will keep their information and set up a time to follow up with them, even if it's doing a reassessment with them or just seeing where they are in, a month or so. And as long as we're providing the resources needed for families, um, we're okay with doing the assessments if someone doesn't move forward. It happens often. We do assessments and we get a call 6 months later and say, oh my gosh, health issues have gotten a lot worse. And we definitely need your support now. And because we did that initial assessment, they remembered us and they were able to follow back up. So it's definitely something very important that we keep in touch with families that we do assessments on.
Wonderful, wonderful. Well, I think this has been so informative, Kelsi. Thank you so much. And I know you guys do great work in the community, and I hope that anybody on this webinar today has a better understanding and knows how to, get a hold of you guys in case they are needing your services. And yeah, we just appreciate you being such a resource to us and so many others in the community. And um, yeah, just appreciate your time this morning, Kelsi.
Yeah, thank you for having me. I appreciate all you guys do. And again, thank you.
Yeah. Thank you, everybody, for hopping on. If you need to get a hold of us, have any questions about this, we can put you in contact with Kelsi as well. You can call us or email us. Our phone number is 317-550-5648, or you can email us at info@indianaparkinson.org. Thank you so much, everybody. Have a great day.
Thank you.